Today we're going to talk about tuberculosis. We're going to go over what is tuberculosis, the common signs and symptoms, diagnosis, and treatment. Tuberculosis, or TB, is an infection that usually affects the lungs, but it can affect other body systems as well. TB is highly contagious and is transmitted from person to person by airborne particles called droplet nuclei. These tiny water droplets with the bacteria are released into the air when the infected person coughs, sneezes, laughs, shouts, etc. These tiny droplets stay in the air for several hours. This is only contracted through air when a person inhales the droplet, not by contact of a surface. These patients in the hospital must be put on airborne contact precautions and placed in a designated negative pressure isolation room. A negative pressure room will better contain the bacteria within the room by not allowing the air inside the room to flow into the hallway. It is also important for you as the nurse to wear properly fitted N95 mask when entering these rooms so you do not breathe in these particles. Common symptoms of TB include fatigue, weight loss, anorexia, low-grade fever, and night sweats. A productive cough will slowly start and become more frequent over weeks to months. TB can be diagnosed with doing a PPD. A PPD is a skin test. The provider will place a small amount of PPD under the top layer of the skin. This will cause a small bump to develop on your forearm. This bump will go away normally after a few hours. The results of the PPD are evaluated 48 to 72 hours after the injection. A negative result means you have never been infected with TB. The inside of your forearm where the PPD was injected will not be swollen, or if there is swelling, it's very small. A positive result means you have been infected with the bacteria that causes TB. The inside of your forearm will have a firm swelling at the site of 5 millimeters or greater. Sputum cultures and a chest x-ray can also be used to diagnose TB. If the PPD is positive, a chest x-ray will be done to diagnose active disease. Treatment of TB consists of multi-antibiotic therapies. The patient then will be followed usually by an infectious disease doctor, a pulmonologist, and their primary care provider. And this concludes our discussion on TB.